Alrighty, well, my topic was on lateral violence. So, what lateral violence is, it's defined as acts that occur between colleagues. Sometimes this can depend on if it's gossiping, meaning talking about each other, bullying, talking bad to one another, scapegoating, which could mean that they um, kind of place blame on something else, and withholding information. Withholding information entails if you know something could is of vital information to the nurse, such as whether if your patient asked to use the bathroom and they never told that nurse or helped that patient, that's actually withholding information. So, with this type of violence, there's actually two different kinds of violence. There's the lateral and the vertical, which means lateral, which kind of think of it kind of parallel, and vertical is up and down. So, the difference between these two is that lateral violence is usually between colleagues at the same level of power. So, this could be nurse to nurse, manager to manager, supervisor to supervisor. And then there is also vertical violence, meaning kind of think of it like as an up and down. So this could be between colleagues of different levels of power. So it could entail from a nurse to a manager as such. However, for vertical violence, it does not only deal with in one motion. So it can actually be manager to nurse, meaning having violence against somebody below you, or it can be actually nurse to manager, meaning it could have violence from down up. So in this one, we're actually going to talk more so about lateral violence, but you'll hear a little bit of some examples about vertical as well, especially since when I relate to us being students. So what causes lateral violence? So the theory is that there's some symptom of oppression. So back in the old day, doctors used to kind of treat nurses like this, and it's kind of almost like a learned behavior. So it's kind of like the nurses that we see now, the more seasoned nurses, they were once in our position or that oppressed position, and now they're doing it to others. It's kind of like a learned behavior. So, like I said, there's a response to offenders being the ones being offended. And so they were on the other side of the lateral violence. And as I was doing my research, I also noticed that there was quite a few references in multiple sites saying that nurses eat their young. And this goes back to, again, kind of being kind of like a learned behavior. And I know we all have kind of experienced it already as being students. So, what does lateral violence have on the effects of nursing and nurses? So, obviously, if someone's being treated bad, they're going to want to leave, of course, you know. I did a couple statistics. According to John Hopkins, every time a nurse, on average, a nurse leaves, it costs the hospital approximately $37,000 to $58,000 per nurse. This could entail, of course, in training, those extra hours they have to put in, the extra people that they have to bring in to train. So it's actually very, very, very costly. I also found out that it didn't kind of surprise me, but the most vulnerable to this lateral violence are actually us, kind of like new graduates. I guess they see us kind of like the fresh freshmen, or, you know, whenever you're just going into high school and like fresh meat. And I also thought this other statistic was kind of crazy, that the turnover rate back in 2015 was 17.2%. I feel like that's actually kind of high, and that actually speaks kind of like badly of companies, because that kind of shows that this kind of type of violence is actually occurring, you know what I mean? So, and I also thought this other one was really crazy, that the amount of nurses that experience lateral violence is 46 to 100%. And I'm pretty sure, I know I can agree with 100% on my end as a student, but I'm pretty sure quite a few of us have already had some form of lateral violence just being in clinicals. Some other effects are moral distress, of course. So this would include you wind up working in a negative workplace environment. You don't want to go to work, you know. Another one, of course, like resigning from jobs, and of course, emotional detachment from work. So as nurses, I mean, we're in this position where you want to be caring and have a lot of sentiment towards your patients. However, when you're treated like this, it kind of detaches you emotionally, and you kind of just look at it like as a paycheck. You don't enjoy your job, you don't enjoy going to work. Let's see. So, what can be done? So, there's quite a few things. Of course, obviously, you want to develop a new culture that shows people that what you're worth. Like you're not just this fresh meat on the floor. And I know these other nurses are gonna have more knowledge than us, but you kind of all got to be looking at each other as equal. You know what I mean? Another one is, I thought it was a good idea, was mentorship program. So when the studies have shown that when you're under mentorship, the mentors actually feel more invested in you, and so they actually treat you better because they actually put in their time to develop you as a mature nurse. Another one would be conflict resolution training to nurse managers. This kind of goes more on the vertical aspect, but I'm sorry, on the vertical aspect. So this could facilitate open communication amongst team members. Of course, encouraging teamwork is also a big thing. I've noticed, being in clinicals, I've noticed quite a few differences between facilities. At one facility, sorry, that's my dog. At one facility, it's like no teamwork. It's such a hard shift, But then you're at these other facilities and everybody's like, oh, what else do you need? And they're big on teamwork, and you can tell because those nurses are happier. You know what I mean? And then, of course, if the lateral violence kind of gets escalated, you can always go to human resources. Since some people feel that if I tell my manager, I see them every day, they may not feel comfortable telling that person. So they may need to bring in a third party to actually help deal with the situation. So in my experience, I know quite a few people here in the Corpus Christi clinical group remember when we were at first semester clinicals at Post-Acute South. It's actually now closed now. There was this nurse that was extremely, extremely rude to me. And I know this is kind of more on the other aspect of violence, not so much lateral because she's actually higher than me. But I mean, she was just extremely rude to every single question we asked. And after a while, it's degrading, and it's not very conducive to what they're trying to do. I mean, we're there to help them, take vitals, finger sticks, whatever we need to do. But when you actually kind of, for no reason, after introducing yourself, get kind of pushed aside and kind of bullied in a sense, you don't even want to help them. You're like, it kind of makes your day there at clinicals extremely, extremely long. Luckily, we had a great clinical instructor, and she saw how she was treating us, and she pulled us aside and said, you know what, I'm going to follow this other nurse, So that's what I found on lateral violence, and those are my opinions and my experience. Bye, guys.